Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hey listeners, it's Lindsay Smith-Rogers. They're back. Questions about whether vaccines are linked to autism. Professor Daniel Salmon is the director of the Johns Hopkins Center for Vaccine Safety. He joins Dr. Josh Sharfstein to talk about where this concern started, why experts have concluded there is no connection, and why, nonetheless, questions persist. Let's listen.
Professor Dan Salmon, thank you so much for joining me today on Public Health on Call. How are you doing?
I'm doing well, Dr. Sharfstein. Thank you for inviting me.
So I want to reintroduce you to our audience. You run the Institute for Vaccine Safety at Johns Hopkins?
That's correct.
Would it be fair to say that your career has been devoted to understanding safety risks of vaccines and working to make vaccines safer?
That's right. I've also done a lot of work looking at why people get vaccines and their decision-making, but a lot of my work is focused on vaccine safety science and improving that science.
Why? Why did you pick that topic?
Well, it probably found me more than I found it. My work in this space started when I was a student at Emory, and an article came out in the Atlanta Journal about a chiropractor telling his patients not to vaccinate. And that caught the attention of David Satcher, the CDC director. And I had initially been working at HIV and was brought in to look at the risks of unvaccinated children, which naturally led to vaccine safety.
So let me ask you, roughly what year was that?
That was more than 30 years ago.
So you've been in and around questions of vaccine safety for more than 30 years.
That's correct.
All right, so I want to ask you about something that has been around maybe for just as long, which is concerns about vaccines and autism as a side effect of vaccines. Can you tell me when this question popped onto your radar screen?
Well, the issue was first raised by an article published by Andrew Wakefield. He was a GI doc in England, Royal Free Hospital, very well-known hospital, and he had published a paper in The Lancet, which, as you know, is a very, very good journal. And he looked at 12 children, most of whom the parents reported developing autism after getting the vaccine. And that's really when the MMR issue and autism arose.
So before that, it wasn't really a common topic to talk about vaccines and autism. But after that article appeared in The Lancet, suddenly it received a lot of attention.
Prior to that, I don't think anybody really talked about vaccines and autism. And after that, there was a tremendous amount of discussion in that space.
And research.
I think that initial research and public health response to that study was fairly limited because it was only 12 children. And it was described as a case series, although really it wasn't even a case series, because typically a case series would be consecutive children, and these weren't consecutive children. But it was described as a case series. And, a case series can't really tell you about something causing something. It can perhaps raise the question, but not answer the question. But once that paper was published in the press release, and moving forward, the lead author, Dr. Andrew Wakefield, went around telling a lot of people that he had shown vaccines had caused autism, which that study couldn't even do. I mean, it's a bit of a stretch even calling it a study. It's a description of 12 children. There was no control group or control period. It was simply a description.
And maybe now's a good time just to point out what wound up happening to that study, the study that really sparked the whole discussion of vaccines and autism.
Well, it got retracted ultimately. Within a short amount of time, several of the authors pulled their names. There were lots of problems later found with what was published. including, as I mentioned, they weren't consecutive children. They were just cherry-picked children. And, we know that given when vaccines are given and when children regress into autism, that there will be a temporal relationship. It'll happen by chance alone. So, from a scientific perspective, it didn't show much. But you had a very well-credentialed, very charismatic person coming from an outstanding institution, publishing this paper in a very prestigious journal, and he really ran with it. I remember at the time I had a young child, and I got a call from my mom. And my mom is a very intelligent, well-educated woman. She had a PhD in community development. And she called and said, I saw this guy on 60 Minutes. And I know this is what you do, because at the time I was working in the CDC's vaccine safety group. And she said, so I don't mean to tell you I know more than you, but, watching him on 60 Minutes made me really nervous. And maybe you should think about separating those MMR antigens and giving separate shots, because that's one of the things that he was proposing. And it was remarkable to me that even with someone who was very well educated and a very public health focused person, she found him very compelling. And let me ask you, Dr. Sharfstein, as I remember, you've met him, you've spoken with him. So what were your impressions of Dr. Wakefield?
You're right. I did have a chance to meet Dr. Wakefield. It was when I was working on Capitol Hill. It was some time after his initial paper was published. And I did find him quite charming and engaging. And even though I didn't agree with what he was saying, I appreciated why so many people were listening to him and why what he had done had generated an enormous amount of attention. I wonder whether it was just Dr. Wakefield that turned the question of vaccines and autism into a topic people really wanted to address, or were there other factors too?
Well, I think that autism is characteristic of a lot of health outcomes that are just ripe for vaccine safety controversies. They happen, or at least they become apparent to the parent early in childhood, around when we give a lot of vaccines. It seems to be increasing in incidence or prevalence, so there's more of it out there. And we don't understand or fully understand the etiology. We don't know what causes it. So you have a lot of parents that are watching their children develop normally and then regress into autism, and they want to know why. They want to know what happened. And in addition, you had advocacy groups, autism advocacy groups, where these parents came together looking for answers and looking for support for their children. So as you think about an issue like this, you have parents going, wow, what happened? What did I do? What happened to my child to cause this outcome, this autism? And then they go, wow, he or she had just gotten vaccinated. And then they talk with other parents of autistic children, and they start to go, wow, my child just got vaccinated too. And, parents are looking for answers, understandably. And they land upon vaccines. And so the issue was very ripe for it to be associated with vaccines, not by cause and effect, but by timing and temporality.
Let me ask you about the research that was spawned by this controversy, because there was a lot of interest in addressing the question that was on people's minds.
Well, whereas I said you can't draw conclusions from looking at a dozen kids, you need to have controls. And so this issue and the attention it got and the concern of parents led to a number of large epidemiological studies where they looked at kids who were vaccinated and weren't vaccinated, in this case with the MMR vaccine. So you had control groups. And those studies found no association between MMR vaccine and autism.
And there were studies done on other vaccines as well?
There were. Well, once it started to become clear that MMR vaccine was not associated with autism, And during this time, some of the conflicts that Dr. Wakefield had started to become apparent. The hypothesis shifted from MMR vaccine to thimerosal vaccine. At the time, thimerosal was used as a preservative in some childhood vaccines. And parents said, oh, okay, it's not MMR vaccine, it's thimerosal. Thimerosal, which was never in the MMR vaccine because it's a live vaccine. It was used as a preservative in multi-dose vials. And that led to a number of studies looking at thimerosal in vaccines and autism. And those studies also found no relationship. And, it's a bit of a whack-a-mole because once the thimerosal hypothesis had been answered by a number of large studies, the hypothesis shifted again. Oh, it's not MMR vaccine, it's not thimerosal in vaccines, it's the number of vaccines you give at one time. And then there were studies of that and also found no relationship between vaccines and autism. So at this point, we have 16 well-conducted studies, large population-based studies, carefully designed, done by different investigators in different countries, using different but strong methods. And all 16 of them found no relationship between MMR vaccine, thimerosal vaccines, or the number of vaccines given in autism. So the evidence is really quite compelling.
So that brings us to the present moment, because despite all of this research, we have not just the Secretary of Health and Human Services, but also the President of the United States saying that there should be more research, and the latest headlines indicating that there might be more research into this same question. The first thing I want to ask you is, why do you think this theory has persisted despite so much research and conclusions about it that have been made, over the years?
Well, I think it's a complicated question. There's not a single simple answer to that. I'm not an autism researcher, but my understanding is that we've identified some causes for autism, and it really should be autisms because there's probably multiple diseases and multiple causes, but there's still a lot of causes we haven't identified. So the question of what causes my child's autism or autism spectrum disorder is still out there. That's one part. Another part is that, it took a bit of time for those studies to be done. More than a year for the first study after the MMR vaccine hypothesis, and in the case of thimerosal, years. And, that's not a long time, but when you have somebody, charismatic, well-credentialed person traveling the world, and advocacy groups and parents jumping on the issue, it creates a void. It creates an opportunity, a vacuum of information. And, it's much easier for information and science to inform someone's views than it is to change their mind. And, at this point in time, about a quarter of the parents thought that vaccines cause autism. They had already made up their mind. And it's very hard to change somebody's mind. I mean, you have heuristics like cognitive dissonance, and I think if the science had been done sooner, and understanding it's hard to do good science. It's easy to do bad science, but it takes time and effort to do good science. But I think if the science were done sooner, that would have helped. I think there was also often distrust of those who were doing the science. And we see that now. When people don't like the message, they attack the messenger. And I think if we had had more trust in public health authorities and more trust in those doing the science, it may have been received in a more impactful way.
What do you think about the idea of doing more research on whether vaccines are linked to autism?
Well, as we've talked about before, Josh, I'm a scientist, and I believe in the value of science. And I think there's lots of places in vaccines and vaccine safety where we can and should do more science. There's a lot we know, and there's a lot of science being done. And the science that has been done has shown that vaccines are very safe. They're not perfectly safe. They do sometimes, very rarely, cause adverse reactions. But overall, they're very safe. But there are places we can and should do more science. When it comes to autism, I feel like the science has already largely been done. It's very compelling. So if you gave me a pot of money and said, let's do more vaccine safety research, which would be great, autism would not be high up on my list because the science is already quite compelling.
Do you have any concerns, as you said, that doing good science is hard? Do you have any concerns that the kind of research that might be done might not be well designed?
I do, because, good science can inform people's decisions and policy and practice, but bad science can be very hurtful because it can confuse people and you can't rely on the results. But as you mentioned earlier in your experience with Dr. Wakefield, you, as somebody with training in medicine and public health, were able to listen to and decipher the arguments being made. But that's not a skill set the average parent or the public has. So I think bad science could be quite harmful.
Just to be clear, when you say good science versus bad science, you're not talking about what the study finds. You're talking about how the study is actually designed to answer the question.
Yes, I'm talking about the rigor of the methods.
Could you give maybe one final example of a rigorous study versus a not rigorous study?
Well, so study, it seems like this should be easy. It seems like, we should just compare vaccinated to unvaccinated children. And one of the things that we often hear from people worried about vaccines is we need to do a vaccinated, unvaccinated study. And intuitively, that makes a lot of sense. If you want to know if smoking causes lung cancer, you look at the rates of lung cancer among smokers and non-smokers. It's rather straightforward, but in fact, it's more complicated than that. Because using the smoking example in lung cancer, if you looked at the rates of lung cancer among drinkers, you would find it's actually higher than non-drinkers. And somebody might conclude, drinking causes lung cancer. Well, that's not the case. The issue is that people that drink are more likely to smoke. And smoking causes lung cancer. So drinking would be a confounder. Drinking would be something that's associated with the exposure and the outcome, but not a part of the causal pathway. And in the case of looking at vaccinated versus unvaccinated children, if you look at children that are truly unvaccinated, it's about 2% of American children. And that 2% is very, very different than the 98%. So, for example, I received an email last week that said, why can't you just look at Amish children and we can figure out whether or not vaccines cause autism and other health outcomes? Well, Amish children are very, very different than other children. And you can, I don't know what you would find regarding autism, but they're different in their lifestyle. They're different in all sorts of environmental exposures and what they eat. And importantly, they're very different in terms of how they access and use medicine and healthcare. And my guess is, and I've never studied autism among Amish children, but even if the rates were about the same, they're probably much less likely to get diagnosed. So these studies are very complicated, and I brought up the issue of confounding. And you really have to adjust confounding when you look at vaccine safety studies, and you really have to look at healthcare utilization. And so these studies can be done. They've been done. They're just not easy to do. And sometimes it's not intuitive.
Professor Salmon, thank you so much for coming to the podcast, talking about this issue, which remains in the news and shedding a lot of light on what caused the controversy and where we are today.
It's a pleasure. Thank you, Dr. Sharfstein.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmond, and Grace Fernandez-Ciceri. Audio production by J.B. Arbogast, Michael Bonfils, Spencer Greer, Matthew Martin, and Philip Porter, with support from Chip Hickey. Distribution by Nick Moran. Production coordination by Catherine Ricardo. Social media run by Grace Fernandez-Ciceri. Analytics by Elisa Rosen. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.